Hi, I'm Dr. Sipalo, and this is Open Conversations on Your Health, Your Life, where I equip you with the information that you need to ensure that you be confident and comfortable on your next doctor's appointment and/or hospital admission. In this video, we will discuss caesarean sections. To all our returning viewers, thank you, and to all our new subscribers, welcome to the family. For everyone else who has not yet subscribed to the channel, make sure you do. It continues to support the cause, and don't forget to turn on the notification bell so that you are informed and alerted every time we upload a new video. In this video, we will discuss caesarean sections. We'll begin with the definition, where we go through what exactly this is. We then move on to some of the reasons why caesarean sections can be done, and then we will go to the main body of the discussion, where we talk about what happens pre-operatively, during theatre, and post-op. And then we will end the video with some of the complications of caesarean sections. So, what is a caesarean section? A caesarean section is basically an operative delivery of an infant, where an incision is made through the abdomen and uterus, and the infant is delivered through this cavity. The incision is usually made on the lower abdomen, which is cosmetically more appealing unless otherwise. So now, why are caesarean sections done? We'll describe this in two main groups. It can either be elective or emergency, right? So what does that mean? When we say that there is an elective caesarean section, it means that it is planned. It is something that you should be aware of through your pregnancy, and you are given a date and are aware when you will come into the hospital so that an operative delivery is performed. On the other hand, an emergency caesarean section is usually one that is not planned for and is one that happens in a lady who was preparing to deliver vaginally, was actually in labor. However, during her labor, some problems arose, and because of those problems, whether they could be fetal distress, which we discussed in our previous video, or a poor progress of her labor, which could not be corrected, will then end up taking her to theatre to ensure that the mother and the baby are well. Elective caesarean sections can further be divided or thought about in terms of certain situations where vaginal deliveries are completely impossible and where there could be a possibility of delivering vaginally, but then for the safety of the mother and the child, a caesarean section is preferred. So what exactly is done? Whether this is an emergency or an elective caesarean section, an IV line will be placed. That is, a cannula will be placed intravenously so that you can receive some fluids. A catheter will be inserted to ensure that your bladder is draining all the urine. Also, some pre-op antibiotics will be given through the IV line. And then also some medication will be given to ensure that while you are lying down in theatre, you do not have any reflux of your abdominal contents. In theatre, anesthesia will be given to ensure that the procedure will be painless. Most of the time, mothers are actually awake during the procedure and are fully alert. And once the infant is delivered, the baby will be shown to the mother while the surgeons continue to operate on her. And after the operation, she is then taken to a recovery room where her vitals will be taken, and afterwards is taken to a ward where she will then meet her baby again, and at this point continue the recovery. Post-op, we try to get every mother active as quickly as possible. We want her to mobilize, we want her to walk. Another thing that will be done is the Foley catheter removed as soon as possible. And then as soon as it is safe for the mother to begin to eat, she will then start to feed and drink as normal. And now we'll discuss some of the complications of caesarean sections. Remember, no operation is without a risk of complication. Same thing applies to caesarean sections. Before the operation, a consent form is signed to ensure that you are aware that some things could happen, right? The complications can be divided into immediate, intermediate, and late, right? So some complications can arise immediately the operation is done, right there in theatre. For example, bowel and bladder injury. These complications normally are even more common in patients who have previously had operations done. That is, women who have previous Caesars and also other abdominal operations that could have been done in the past. Another complication could be bleeding. There is a possibility of bleeding during the operation. And again, the surgeon should be able to arrest that bleeding. And sometimes blood could have to be transfused during the operation. The intermediate complication could be an infection. It is possible that the incision site could become infected. This could be while in the hospital if you spend a few days here, or it could be while you are at home in the instance that you were discharged after the delivery. One of the late complications could be that as a woman who has had a Caesar done, you are at higher risk of having a Caesar in your next delivery, right? So that is to say, the more Caesars, the more chances of having another one done. Hopefully you are more informed on exactly what a caesarean section is and what goes into the procedure. Thanks for watching, and don't forget to like the video and share it with anyone who would benefit from it. See you in the next one.